One of the compromises we always need to make with an off-the-shelf implant is how it fits the tibia. When we cut the tibia, we're often left with a bone surface that looks somewhat like a kidney bean. Implants that are off the shelf try to replicate that as closely as possible, but because there's so much variation in the patient's anatomy, they never fit exactly right.
In a traditional off-the-shelf implant, the design of the tibial tray is uniform. It doesn't allow for any shape changes between the lateral and the medial side. And typically the medial side is a much different shape than the lateral side. So after you make your tibial resection, you have this oblong shaped cut. And if you're trying to put a traditional implant tray on that, it doesn't fit properly. So you're constantly making compromises to get a reasonable fit, but at the same time not rotating the tibial tray so that you're creating rotational abnormalities which lead to chronic pain.
Other companies have tried to address it by making what is called an asymmetric tibia, one size bigger than the other. But even then, that doesn't really solve the problem of setting it in the right place in the right rotation. What the Conformis system does, because it's made specifically for the patient, it covers the whole area beautifully, so you don't have any open areas, and it prevents any malrotation, because to cover the whole area completely, you cannot malrotate it, it fits in.
With the Conformis implant, because it's made specific to that person's anatomy, being larger on one side than on the other, then it's only going to fit on one way, and the one way that's going to fit is the way that the tibia was made to rotate. So that can eliminate a lot of the problems that lead to increased wear in the implants and range of motion problems due to improper rotation of the tibial base plate.
The Conformis implant, by matching the patient, covers that bone completely, and we found that there's very little exposed bone on the proximal tibia, which can not only bleed, but is required to support that implant. So the advantage of covering the whole tibia and having the correct rotation compared to the ankle, I believe, is crucial.